listener said scholar. This lesson is going to talk about ABGs. And, one thing, the NCLEX is not testing whether you can do ABG math, but you need to know the numbers. Um, it's testing whether you can recognize when a patient is compensating and when they're failing. So if ABGs, make your brain shut down, this video is for you. I am going to, this video, I'm going to go over how you figure out the ABG, if it's respiratory acidosis, respiratory alkalosis, so on and so forth. I'm not going to go over the clinical signs on this video. That's going to be another video, but I'm going to take my time and show you how to figure it out. When I was first preparing to teach this because I've taken ABG, learned ABGs a long time ago, right? But when I was trying to prepare it for students, they have the tic-tac-toe method and the Rome method and all this other kind of stuff, and it was very confusing. And so I sat down and I said, there's got to be an easier way. And so, I mean, maybe someone else has done this, maybe you've seen this before, but if not, I believe this way is really going to help you. So, one thing, students panic because, we're taught to calculate instead of recognize. We're taught to memorize, the normal values, to do the step-by-step formulas. We overthink every number. And, the NCLEX really wants us to, figure out something pretty simple. Is the patient maintaining acid-base balance or are they losing it? So, let's think about this. ABGs are about breathing, perfusion, and compensation. And the NCLEX, when they test you, they want to know, is the pH normal or abnormal? Is this respiratory or metabolic in nature? Is the patient compensating or failing? And what's the next safest step? So on this slide, you have to know the baseline numbers when answering ABG questions. Now, of course, every school uses a different reference. When you go into hospital, they may have their own reference, but this is a basic baseline reference that I'm going to use for today's lesson. pH 7.35 to 7.45, CO2 35 to 45, bicarb 22 to 26, PaO2 80 to 100. All right, let's move on. So, always start with the pH when you're looking at an ABG. The pH is going to tell you whether the blood is acidic, normal, or alkalotic. On the NCLEX, an abnormal pH is a problem. So if it's outside of the range, something's wrong. Now, if you see a normal pH, but with abnormal values, then you know that there is compensation. So I'm going to go over that further along in this lesson. Ask yourself, is the body keeping balance? Or is it losing control? I really want to do this. I don't know, I don't want to call it steps, but just I want to try to help you make this click to figure out whether, is this ABG problem is respiratory or metabolic. And like I said, you have to follow the pH because less than 7.3.5, the patient has acidosis. Greater than 7.45, the patient has alkalosis. The pH, now remember this, the pH tells you what kind of problem exists. So let's match the pH to the source. CO2 is controlled by breathing. Okay, so if the CO2 is high, that means the patient is not blowing off that CO2. Okay, they're retaining the acid. And because CO2 deals with the lungs, it's a respiratory problem. But think of it like this. If the CO2 is high, they're not able to blow off that CO2, like I said. Now, carbon dioxide plus water creates carbonic acid. So if that CO2 remains in your lungs, it's going to mix with the water and create acid. And that's where that respiratory acidosis comes from. If the CO2 is low, the patient is blowing off that CO2. They are breathing rapidly. I mean, they are breathing rapidly, okay? And that's seen in anxiety. A person is hyperventilating. It's still respiratory in nature, but it's alkalosis because they're blowing off all of that acid. Now, when you're looking at bicarb, bicarb is controlled by the kidneys. It's metabolic in nature. So if the bicarb is low, that means, okay, so think of bicarb as neutralizer. If it's low, that means that it doesn't have enough neutralizer to neutralize the acid. So you'll have metabolic acidosis. If it's high, that means you have too much neutralizer. And so you've gotten rid of all of the acid and now you have this, base left. And so that's going to be metabolic alkalosis. So let's think about pH and its relationship with CO2 and bicarb. It sounds like I'm saying the same thing over and over again, but I'm trying to get you to understand. You look at which value matches the pH. So CO2 represents the lungs, bicarbonate represents the kidneys. If the pH is acidic, a high CO2 points to respiratory acidosis. If there is a low bicarbonate, it points to metabolic acidosis. So when you're looking at ABGs, you're looking at the pH. If the pH is acidic, then you're looking at the CO2 or the bicarb. And you're going to ask yourself which one of those are acidic as well. And so let's just say the respiratory, the CO2 is high, meaning acidosis. So now you have your match. The pH is acidic, the CO2 is acidic, so you have respiratory acidosis. Okay. When your pH is alkalitic, a low CO2 points to respiratory alkalosis. If there is a high bicarbonate, it points to metabolic alkalosis. Okay, so if you can listen, the value that matches the pH tells you where the problem is coming from. Okay, remember CO2 equals lungs, which is respiratory. Bicarb equals kidneys, which is metabolic. Now, the next step is there compensation? This is where students might overthink. Compensation means one system is trying to fix the other. So if you have metabolic acidosis, so the kidneys, um, they're not holding on to enough bicarbonate, so you're going to have metabolic acidosis. So when there's a metabolic problem, the respiratory system is going to try to fix it. And what's the body going to do is start making the body blow off CO2 faster to try to bring down the amount of acid in the body. Okay. If you have respiratory acidosis, the kidneys are going to try to retain that bicarbonate to try to bring down the amount of acid that the body has. So on the NCLEX, partial compensation is where the pH is still abnormal. Full compensation is when the pH is back into within normal limits. Okay. So compensation just means is the body coping with what's going on. And also, when you're looking at compensation, once you know the source, so let's just say the source is the kidneys, you're going to look at the other source to see if it's trying to correct the problem. So you're going to ask yourself, is the opposite value abnormal? Is is it trying to move the pH back to normal? So if you're looking at one source and the opposite is normal, then the disorder is uncompensated. If one source is abnormal, well, okay. So if you have a source that is abnormal, you look at the other source. If the other source is normal, then it's uncompensated. Okay. If you are looking at a source and the other source is abnormal, which means it's trying to correct the problem. Now you look at the pH. If the pH is still off, then it's partially compensated because the body, the other source, is trying to fix the problem. And then if you have a source that's abnormal, the other source is now also abnormal, and the pH is now normal, then you have fully compensation. Okay. We're going to go over some questions to try to help you kind of get that. But before we do that, we're going to look at oxygenation. And I'm throwing this in there because ABGs aren't just acid base. If the oxygen is low, breathing is the priority. Assessing the respiratory system and the patient's breathing, that becomes priority. Oxygenation outranks compensation. You have to understand, if you can't compensate if you can't oxygenate. So if there is a low O2, that is the immediate concern. Okay, don't forget that. Now, a tip, and I've already kind of talked about this, but when you're looking at ABG questions, you don't start with the CO2 or the bicarbonate. You will always start with the pH, because the pH tells you what the body is experiencing. Then you're going to go pH, what's the source? Is the body compensating? And then you're looking at safety. And this is the sequence: pH, source, compensation, safety. And that is the NCLEX. That's what they expect you. That's what they expect, how you should think. All right. So let's get to some problems. All right. So when you're looking at this ABG, the pH is 7.3. It's acidic, so it's low on the scale. The CO2 is 55, which is high, which is also acidic because that patient is holding in that CO2. And now you know the pH is acidic. You're finding the matching source, which is the CO2. So you know it's respiratory. Okay, so now you have respiratory acidosis. Now you're looking at the opposite value, the bicarbonate, but then it's normal. Okay, so that means that it's uncompensated. So you're going to ask yourself, is the pH normal? No, the pH is acidic. Does the CO2 explain the pH? Yes, the CO2 is high. You have acid retention. Is this respiratory in nature? Yes. The CO2 explains the pH, so you know it's respiratory. Is there compensation? Not yet, because the bicarb is still normal. So there's no compensation. And so the risk here would be respiratory failure. So the pH is acidic, the CO2 is acidic, so it's respiratory acidosis. The kidneys haven't compensated yet, so it's uncompensated respiratory acidosis. That's it. That's it. If you can get that rhythm, no panic, no math. Always know that breathing wins. The patient is priority. Think of it like this: the patient is retaining CO2. There's a breathing problem. You're going to assess the airway and make sure that the patient is ventilated. Let's move to another one. All right. So here we have a pH of 7.32, a PCO2 of 30, a bicarb of 18, and here the patient's O2, PaO2 is 90. So you know that's within normal range, so they're oxygenating okay. So number one, what's the pH? 7.32, it's acidic. So now you have to find the source. In this one, the bicarb is 18. Our range was 22 to 26. So we have a low bicarb. And that means that there isn't enough neutralizer to neutralize that acid. So we have too much acid. So now we have metabolic acidosis. Okay. Now we're looking at the CO2. The CO2 is low. Okay. So the lungs is trying to blow off that acid that's being caused by that metabolic acidosis. So the pH is acidic, the bicarb is acidic. So that's metabolic acidosis. Now we're going to look at the opposite source, which is your respiratory. It's low because it's trying to blow off that acid. So now you know that it's compensating. Now you go back to the pH, but the pH is still abnormal. So that's partial compensation. So it's partially compensated metabolic acidosis. The body is trying to fix this, but the problem still persists. And the reason why the problem still persists is because the pH is not normal. Okay, let's go on to the next one. All right, here's another one. This one is a little, well, I mean, it's tricky. It's not tricky, but I'll explain what I mean when I say that. So you have a pH of 7.42. Well, that's normal. Okay. You have a PaCO2 of 48. You have a bicarb of 30, and you have a PaO2 of 95. So You're going to look at the pH. So the pH is normal. So you're like, well, what matches that, right? Well, a rule of thumb is your pH is 7.35 to 7.45. In the middle is 7.4. So if the pH is on the alkalytic side, that means it was alkalytic in nature. If it's on the acidic side, if it's less than 7.4, you know it was, acidotic. Now, schools should not trick you by doing 7.4. That's just too difficult. They're going to go on either side of that 7.4, that midpoint. If they don't, I'm so sorry. That's kind of cruel. But they typically schools will not do that to you. So in this problem, it's 7.42, so it's on the alkalitic side. So now you have to find out what else is alkalitic. Okay? So your uh, bicarb is 30. So it was 22 to 26. So it's alkalotic. So you'll have metabolic alkalosis. Now you're going to look at the opposite, which is the PaO2, which is 48. So it is blowing off the oxygen. Okay, so it's abnormal. And then, like I said, you go back to the pH to see if it's normal. So this one is fully compensated metabolic acid alkalosis. I apologize. So with this one, the body is coping. It's not the most concerning patient because the oxygen is normal, the pH is within normal range. So this patient is pretty good unless the oxygenation starts to decline. Okay, let's see. We have another one. The pH is 7.48, so that's alkalitic. The CO2 is 28, so it is low, you know. So it has been blowing off that CO2. So it is alkalotic as well. So you have respiratory alkalosis. Now we're going to look at the kidneys. The kidneys is between that normal 22 to 26, so it's normal. So there's no compensation. So you have uncompensated respiratory alkalosis. Now, a lot of times this happens when people have anxiety or pain and they're breathing really fast. So that's typically where you'll see respiratory alkalosis. Next. All right. So with this one, you have a pH of 7.28. So that's acidotic. So now you have to find the matching source. So the PaO2 is 60. That means the patient is retaining um, CO2. So that's acidotic. So this patient is going to have respiratory acidosis. Now you look at the opposite source. The opposite source, the bicarb, is normal. So it's uncompensated. All righty. Now with this one, you're looking at the oxygen saturation. The normal oxygen saturation should be between 80 and 100. It is 68. We have a problem here. The patient has an acidic pH. They have a rising CO2 that's causing acidosis. The bicarb is normal, so there's no compensation. So you have uncompensated respiratory acidosis. The oxygen is falling. The patient is failing to ventilate and oxygenate. This is an emergency. The person is developing respiratory failure. So you have to think airway and breathing immediately. So, when the CO2 starts to rise, they're retaining that carbon dioxide, and the O2 falls, the compensation is failing. This is not a math problem. It is respiratory failure. Okay. So, we're almost to the end. So now, when on NCLEX and in school, they're going to test both. They're going to test the numeric patterns of questions, how to interpret the ABGs. What's the number of the pH, the bicarb, the CO2? Is it respiratory? Is it metabolic? And is there compensation? And then 50% of the other questions typically be the clinical signs. Does the patient have altered mental status, fatigue, shortness of breath? What do these clinical signs, what do they match with when you're looking at the ABGs, respiratory or metabolic, acidosis or alkalosis? And the NCLEX expects you to be able to do both. Okay. And so does usually your nursing programs. So in the end, when you're looking at ABGs, ask yourself these questions. What is the pH trying to tell me? Which value explains it? What's the source? Respiratory or metabolic? Is there compensation? Is the oxygen saturated, was the oxygen adequate? And what can I do right now to protect my patient's life? That is what we're thinking about. So when you're looking at ABG questions, the NCLEX, wants to know, can the patient breathe? Are they compensating? Are they getting worse? What action is going to protect life? You're looking at the clinical signs, you're looking at the ABGs, and you should be able to tell, what's going on with your patient. Are they getting better? Are they getting worse? What can I do now as the nurse? Or what, orders can I anticipate to help my patient? And like I said, they want you to know, can you tell as a nurse, is the pH worsening? I'm going to keep repeating this stuff. Is there a loss of compensation? Is the CO2 rising? Is the patient with fatigue? Is the patient fatigued? Is there a falling O2 despite respiratory support? Because if all of these things are present, respiratory failure, and that is what we're trying to get you to understand. Can you look at the patient's presentation? Can you look at the ABGs and tell if the patient is getting better or getting worse, and how can you intervene? And that is it. Um, it takes a while. Go through and just listen to the PowerPoint. I give you all of the tools that you need to be successful when it comes to ABG questions, uh, because ABGs are overwhelming, and I hope that this lesson may provide you some, relief. You may have to listen to it a couple of times, but hopefully it gives you a better understanding of, oh, I get it. Just writing it down and following it, you should get it. So in the next lesson, like I said, I'm going to review the clinical signs associated with ABG conditions, and then I'll continue with the series looking at labs to medications and fluids, so you can learn which orders are on become unsafe. So please subscribe so you don't miss it. I'll have a corresponding workbook on nurseedscholar.com. When please keep looking at the website until it's released. And all of this is to help you study smarter and test like a pro. So until next time, happy studying from Nurse Ed Scholar.